Circulatory system diseases. Atherosclerosis is a disease in blood vessel, specifically in arteries, which is associated with cholesterol buildup called plaque inside the walls of the arteries. Arteries lose their elasticity and degenerate or decline. The following are atherosclerosis symptoms, prevention, and cure. Another type of blood vessel disease is stroke, which is commonly experienced by elders. It is a sudden numbness or weakness of the face, arm, leg, especially on one side of the body, confusion, trouble speaking or understanding, trouble seeing or blurred vision in one or both eyes, trouble walking, dizziness, loss of balance or coordination, and severe headache. The following are the prevention and cure of stroke. There are three types of stroke: thrombotic stroke, embolic stroke, cerebral stroke. Each has different causes. Thrombotic stroke happens when a blood clot known as thrombus forms in one of the arteries that supply blood to your brain. A clot may be caused by fatty deposits or plaque, which comes from eating a lot of fatty foods that build up in arteries and cause reduced blood flow or other arteries condition. If a thrombus or blood clot form in one of the arteries, the blood will not be able to circulate normally, to be supplied to your brain, which will eventually cause stroke. Embolic stroke. It happens when a small artery of the brain is blocked by either a blood clot, usually from the heart, broken free, and traveled to the brain as an embolus. Sometimes, the clot can form in the aorta, which is the largest artery in the body. What is the difference between thrombus and embolus? Thrombus and embolus are blood clot both caused by fatty deposits. Thrombus develop when a fatty deposit blocks the blood from passing through. Thrombus is a blood clot that forms in an undamaged vessels, and if it breaks and travel through bloodstream, it become embolus. Embolus move through blood vessels until it reaches a vessel that is too small to let it pass. If it happens, blood flow is stopped by embolus. Cerebral stroke or cerebral hemorrhage is caused by an artery in the brain bursting and causing localized bleeding in the surrounding tissues. This bleeding kills brain cells. Now, if you ask about heat stroke is also known as sunstroke. It is not an actual stroke. Heat stroke happens when a dehydrated person did not able to sweat fast enough to dissipate heat. It causes the body temperature to rise. Again, it is not the same as stroke. Now, let's talk about the heart diseases. Hypertensive heart diseases or hypertension are commonly known as high blood pressure. It is a result of tightening of the arterioles, the smallest arteries of the body. It increases the resistance of blood flow. High blood pressure does not mean you have a high amount of blood in the body, which is some people's misconception. Hypertension is when the pressure of the blood flow increases. Think about of the water in the faucet. If you turn on the faucet at the maximum and cover its mouth, it resists water from coming, increasing its pressure. If the arterioles tightens, that's what happens to blood. Blood diseases: hemophilia, anemia, and leukemia. Hemophilia occurs when blood does not clot properly, caused by the lack of plasma protein associated with clotting. Hemophilia may result to anemia because of continuous blood loss. Plasma helps blood to clot. When there is lack of plasma in the blood, blood does not clot properly, causing the wound to heal slowly. These are the symptoms, prevention, and cure. Anemia. Anemia happens when the red blood cells count stays persistently low, below 4 million. The normal RBC count for men is 4.7 to 6.1 million. And the normal RBC count for women is 4.2 million to 5.4 million. It may result from nutritional deficiencies, excessive loss of blood, and hereditary. These are the symptoms, prevention, and cure. Last but not the least, leukemia. Leukemia is an abnormal increase in the number of damaged white blood cells. one of the most dangerous blood disorders. It is most likely to affect people over the age of 55 years, but is also common cancer in those aged under 15 years. When there is an uncontrollable growth of damaged WBC, healthy blood cells die. These develops in bone marrow. Bone marrow produces more cancer cell which begins to overcrowd the blood, preventing healthy WBC from growing and functioning normally. These are the symptoms, prevention, and cure.